Hi class. We are going over chapter 9, which is obstetrics and neonatology. So please make sure you have your book with you. We are on page 316, and that's where we'll be beginning. So we're talking about obstetrics and neonatology today, and they are two different branches of medicine, so we need to be able to differentiate between what each one specializes in. Obstetrics is the branch of medicine that's going to deal with the mother and the childbirth in the moment, and then the mother before and after the childbirth. Neonatology is the branch of medicine that actually deals with the newborn. So neonatology, if you want to break that word down, has it has the word root nato. It has neo, which is the prefix for new. Nato is it could be birth or it could be a baby, and then ology is the study of. So this is the branch that studies the diseases and the treatments and the diagnosing of disorders in the newborn. So on page 316 is where we'll find our terms that relate to pregnancy. And let's start with the first one. The gamete is the mature germ cell. This is either going to be the sperm in the male or the ovum in the female. Ovulation is the expulsion of a mature ovum. And what that means is ovulation is when the mature ovum in the female is released from the ovary and travels into the fallopian tubes. Conception or fertilization are the beginning of pregnancy. And this is when the sperm enters the ovum. So conception normally occurs in the uterine tubes, which is called fertilization. And so as the egg or the ovum is released from the ovary and travels into the fallopian tubes, that's where conception or fertilization begins, is whenever the sperm and the ovum meet. A zygote is the cell that is formed by the union of the sperm and the ovum. And so the zygote usually starts to form within the fallopian tube as well. The embryo is the unborn offspring, and we typically call an embryo from the time of implantation of the zygote. Remember, the zygote is when the ovum and the sperm have joined. So the embryo is called that from the minute they implant to about the 8th week of pregnancy. That is what an embryo is. Once we pass the 8th week, we begin to call the baby a fetus, and that is the unborn offspring from the 9th week of pregnancy until the birth of the baby. Gestation or pregnancy is actually the development of a new individual from conception to birth. Remember, conception is the same thing as fertilization, which is when the ovum meets the sperm. And then gestation or pregnancy is the actual development of that individual, of that human, from conception until the time of birth. Implantation is the embedding of the zygote in the uterine lining. And so in order for a pregnancy to occur, the zygote that has been created by fertilization must implant in the uterine lining. If that does not occur, then there is no pregnancy. During the duration of the pregnancy, which is typically 9 months, what do we call each of the 3 periods? We call those trimesters. Some more terms that relate to pregnancy. This is on page 317. The placenta or the afterbirth, that is what grows on the wall of the uterus during the pregnancy. It's like a sac of fluid and different nutrients. It allows for the nourishment of the unborn child, and it comes directly from the mother's blood. The amniotic sac is the membranous bag that surrounds the fetus before delivery. So the fetus is in the amniotic sac along with the placenta, which grows on the wall outside of the amniotic sac. So the amniotic sac has 3 layers. The outermost layer of the fetal membrane or the amniotic sac is the chorion. The amnion is the innermost layer of the fetal membrane or the amniotic sac, and the amniotic fluid is actually the fluid that's inside of the sac, and that allows for the ability of the fetus to not have any injuries while in the amniotic sac. So this image is on page 316 of your book. It is also on here. So let's look at it and break it down a little bit. This is the coronal view of the female reproductive system. Coronal, remember, is us looking at something from the front to the back or from the back to the front. In this case, we are looking at the patient from the front to the back, but we've also taken a cross section of the uterus and the cervix and vagina off, and so that way we can actually look at the inner details of this organ. Notice how the two ovaries are on either side of the uterus, and notice how they're not connected to the fallopian tubes directly. In fact, these fimbri are little finger-like projections at the end of each fallopian tube, which actually serve as like fingers. They grab the ovum as it's being released during ovulation from the ovary, and they guide it through the fallopian tube. Notice how it's right here. This is where fertilization happened in this instant. The sperm has entered the ovum and is now fertilized and becomes a zygote as it starts to go through the process of mitosis and meiosis. And then it travels into the uterus. This is the fundus, or the larger part of the uterus. The fundus is just a medical terminology that is associated with different organs that have this larger space. A stomach has a fundus as well. Implantation is when the zygote implants into the uterine lining. Remember, if implantation does not occur, pregnancy does not occur. And so if a zygote reaches the uterine lining and cannot implant, then it is now no longer viable. And then the cervix is down here, and the vagina is the canal that's right underneath it. So if we want to fill in some blanks, let's turn to page 318 where we can, and 318 and 319, and we can look at some word parts and combining forms. Umbilicus is going to be omphalo, and as you can see, it's O-M-P-H-A-L-O, not O-M-F-A-L-O. That is the combining form for the umbilicus, or the umbilical cord. Fetus has two combining forms, feto or feti. And notice how feti has the I as opposed to the O. So you can use either O or I as your combining vowel when you're using the combining form fet, O or feti, or feto, feti, because it's for pronunciation. It allows for the pronunciation of the terms. Amnion is amnio. And remember, the amnion, or the amniotic sac, is the actual sac itself. Amniotic fluid is that fluid that's within the sac, and it is amniono. So amnio and amniono, and those are used for the amnion or the amniotic fluid. And then chorion, which is chorio, is also located in the amniotic sac. This image is in your book. It's on page 317. This is a human male fetus at 68 days. It's about 47 millimeters long, which is about an inch, 1.85 inches, about 2 inches long. Notice how it has the right frontal and left views, and it's pretty much fully formed at 68 days. It's just going to continue to grow and develop. All right, so let's look at some word parts that relate to obstetrics and neonatology. Remember, obstetrics is the study of the mother and the childbirth, and then neonatology is the study of the actual newborn and all of the diseases that relate to the newborn. So let's look at some combining forms of obstetrics and neonatology. Page 318 is where we're going to be at. Amnio and amnion, like we said before, is the amnion or the amniotic fluid. Chorio is for chorion. Embryo is the embryo, obviously, that we just looked at. Figure 9.3, if you want to look at figure 9.3 on your book in page 318, it breaks down what embryo kind of became, how it became embryo. It comes from the Greek em, meaning in, plus bruo, meaning to bud or to shoot. And so that's how they came up with the term embryo. Feto or feti, again, is fetus or unborn offspring, and we can use both the I or the O as the combining vowels. Gravido is pregnancy. Lacto is milk, which that's pretty common sense, right? Nato is birth. NATO is also an organization. a governmental multinational organization, but that's beyond this lesson. Omphallo is an umbilicus or the navel. Paro and parto are both used for bearing, giving birth to, labor, or childbirth. And then also puerpero is a combining form for childbirth. So let's look at some of these combining forms that we use in obstetrics and neonatology that we've learned in the past or that we'll learn today. We know what cephallo is, which is head. Esophago is the esophagus. This is a new one, primi or primi, which is first. And notice that the original combining vowel for this is I. Pseudo is false. We've learned this one before. Pyloro is pylorus or pyloric sphincter, and this has to do with the stomach. And so when we go into the abdominal, the gastroenterology section of this book, you'll learn more about the pylorus, but this is relating to the stomach. And then terato is malformations. Speaking of terato, this is called a teratoma, and it's disgusting. Notice the breakdown of this terminology. Terat-o, without the O, because oma has an O already. So if we were to break it down, terat is the word root, oma is the suffix, and this is a dermoid cyst. Really what it is a malformation that has formed within the uterus, and it's a collection of hair, skin, nails. It could be a collection of different things, and typically it forms, and sometimes the patient displays signs of pregnancy when they have a teratoma, but they do not have a pregnancy. All right, let's turn to page 320. We're looking at our prefixes and suffixes now. Ante and pre, common sense, it is before. Micro is small. Multi is many. Nulli is none. And post is after. Our suffixes, we are adding to our list of suffixes that we've learned this semester so far. Amnios is the suffix for amnion or amniotic fluid. Siesis is the suffix for pregnancy. E is a noun that has no meaning, and so is is. It's also a noun that has no meaning, and they're both used for pronunciation ease. Rexis is a new suffix that has the RRH beginning, and it means to rupture. Tosia is the suffix for childbirth, and then and us is the noun or suffix, a noun suffix that has no meaning. Just like e and is, and us is used for pronunciation. One of the suffixes that we have learned in the past that has no meaning but is used quite frequently is -a, which also has no meaning, again, helps with pronunciation. Rexis is our fourth, am I able to go back? It's our fourth RRH suffix, which means that it is built off of the RRH letters. We learned RIA, which is flow or discharge in chapter 4. We learned RASIA, which is rapid flow of blood in chapter 5. RAFI is suturing or repair, and Rexis, which we learned today, and that is rupture. And this is just a cute little puppy. It says, keep calm and say ARG because of the RRH if you did not understand that joke, because apparently I'm not that funny. All right, so let's review. Which of the two following word parts means pregnancy, gravido and siesis, or paro, parto, and tosia? So tosia actually means birth or labor. Paro and parto also mean birth or labor. They also mean to give birth to or to bear. However, gravido and siesis are the two that mean pregnancy. This is an individual, and it's funny that this picture is here because of what we talked about in class a couple of periods ago. This is an individual who is they are not trans in the sense that they have had the complete transformation. They have had some transformations, but this was an individual who was a female and transformed through surgeries into a male by removing the breasts and possibly taking some hormones at some point to develop the facial hair. But this individual chose to keep their female reproductive organs. So they did not have any kind of reconstruction or any kind of surgery, and that way they were able to bear a child. And this individual was actually on some talk shows. I remember seeing him on some talk shows and hearing about his journey of becoming pregnant as a male. It's really actually very fascinating. All right, so we are going to look at some obstetric disease and disorder terms that are built from word parts. I'm going to kind of go through these a little quickly, so if it's too fast for you, you know you have access to these terms in your book. Surprise, surprise. All right, amnionitis is the inflammation of the amnion. Please notice how I pronounce words, and if I screw it up, I'm sorry, I'll try again. Chorioamnionitis is the inflammation of the chorion and the amnion. And notice how there's an animation on your Evolve site. You should be using this website quite frequently. Choriocarcinoma is cancerous tumor of the chorion. Dystocia is difficult labor. It can be caused for a lot of different reasons. It just leads to a very long and difficult labor. Hysterorhexis is the rupture of the uterus. That sounds very painful. Oligohydramnios. Oligohydramnios is scanty amount of water. Remember, oligo is very few, so it's a few amount of water, a low amount of water, which is not good. Polyhydramnios is the opposite. It's too much water. And sometimes it's just called hydramnios because of the fact that it is too much than normal. All right, abortion, which is abbreviated as AB, is the termination of pregnancy by the expulsion from the uterus of an embryo or fetus before viability. It's usually before 20 weeks of gestation. That's typically when abortions, if legally allowed, can happen. Spontaneous abortion is something that occurs in the body without any outside influences. It's typically what you would call a miscarriage. It's when a pregnancy is spontaneously terminated through natural reasons. And then there is an induced abortion. That's the intentional termination of pregnancy by surgical or medical intervention. So there are two types of abortion. There is spontaneous and intentional, and spontaneous is what we call miscarriage. Abruptio placentae is the premature separation of the placenta from the uterine wall. We'll talk about that in just a little bit. Eclampsia is the severe complication and progression of preeclampsia, which is categorized by convulsions. And eclampsia is a potentially life-threatening disorder. So when a woman has eclampsia during pregnancy, she's pretty much going through seizures or convulsions, and that is something they try to prevent. So when they see that a patient is going through preeclampsia, which is seeing those signs, high blood pressure, protein in their urine or proteinuria, but they're not getting those convulsions yet, and they don't know why it's happening. They still don't know why this happens. But what they do is they treat the high blood pressure and they treat the protein in the urine by reducing the amount of protein that the mother can have, and that typically gets rid of the symptoms and allows for the mother to continue with her pregnancy. An ectopic pregnancy is a pregnancy that occurs outside of the uterus, and typically this happens in the uterine tubes or the fallopian tubes. This type of pregnancy is not viable. They have to terminate the pregnancy. Notice on page 324, figure 9.4, you can see that there is an ectopic pregnancy in the fallopian tube. That cannot continue. It can kill the mother. Placenta previa is the abnormally low implantation of the placenta on the uterine wall. And so when it implants low, and I'll show you in just a second right here, this is a normal placenta right here. Notice how this placenta is just, this is abruptio placenta. The placenta kind of starts right here. This is the placenta. It's the sac that has the nutrients. Notice how it is attached to the chorion, which is the umbilical cord, and the nutrients flow from the chorion into the fetus in the amniotic sac. Abruptio placentae is when the placenta spontaneously detaches. As you can see here, it's detaching from the wall of the uterus, and it leads to the baby kind of not being held in place like they need to be. And this can lead to a lot of complications. Typically, a mother will be on bed rest if they do not have a emergency C-section. Placenta previa is when the placenta is implanted too low. So notice how the placenta here is just completely blocking the cervix. Notice how there's blood coming out. So if the baby or the fetus gets large enough, they can cause a little bit of bleeding if the placenta starts to rupture slightly. With the severe hemorrhaging, they will have to do an emergency C-section to save the mother and the baby's life. And then this is another view of the ectopic pregnancy. This is the fallopian tube. Here is where those finger-like projections would be, and this is where the uterus would attach. And this right here is that ectopic implantation. And this is just the view of the actual fallopian tubes with reference with the surgical tools. So see how small these organs are. These are tiny organs. We don't have ginormous ovaries and fallopian tubes and uterus. They're fairly small sized. Here's the ovary. Here are those finger-like projections of the fallopian tube. And this is actually where the implantation occurred. Here is your uterus right here. You as a female, not a male. Okay, so we talked a little bit about obstetric diseases and disorder terms. Remember, that is the study of the mother and of the fetus, the unborn fetus. Neonatology is the study of newborn babies and all of their conditions. And so some of the terms from word parts that we use for neonatology include microcephalus, which is a fetus with a very small head. This is indicative of an abnormal development of the brain. Omphalitis is the inflammation of the umbilicus. Omphalocele is a herniation, as you can see right here. This is an omphalocele. It's a herniation of the umbilicus where a part of the intestines is going to come through and protrude through the abdominal wall at birth. Sometimes the intestines are visible, sometimes they're not, but for the most part, it's just a protrusion. And you can see right here on this ultrasound that they already noticed that there is an omphalocele. Pyloric stenosis we already know is narrowing. And this right here is an image of pyloric stenosis. Here is your pyloric, this is the esophagus right here, and your diaphragm is this line right here. Your pyloric sphincter is right over here, and it pretty much allows for food to go in one way and not come back out. So when you're eating, it doesn't keep regurgitating back into your stomach as it goes into your duodenum, which is the first part of your small intestine. Pyloric stenosis is where that sphincter gets very, very small, and it forces food to stay in the stomach. And so as the baby is in utero or when they're first born, they may have regurgitation problems where they can't keep food down because the sphincter is so small, it's not letting the food pass through. Tracheoesophageal fistula is this right here. What happens, and we know what a fistula is, it's an abnormal passageway between two organs. In this case, it's between the trachea and the esophagus. Well, that's a big problem because if we have a fistula or an abnormal opening between the esophagus and the trachea, we have food going into the trachea when it should not. And that means that the newborn can aspirate food, which means that they will choke on the food and possibly die. So this is a pretty big deal. They need to fix this with surgery. All right, so how do we correctly label this image? Well, we have omphalocele or omphalcele. Well, even just pronouncing the second one is really hard to pronounce. That's why we have that combining form with a combining vowel. Omphalocele is much easier to pronounce than omphalcele, and so the answer is A. And notice how you can see the little baby's intestines protruding through the umbilical cord or the umbilicus. All right, let's look at some neonatology disease and disorder terms that are not built from word parts. So these are the ones that we cannot break down. Cleft palate or cleft lip, which I'm sure you've heard of, is the congenital split of the lip. Notice here how the lip is split, or the roof of the mouth, one or the both are present. And a cleft is another word for a fissure. A fissure is like a break or a large opening. And so notice how the palate, the hard palate of the newborn is split open. It's not completely formed, and it leads to that opening in their cleft area. And so they can actually perform surgeries on this and fix this. Down syndrome is a genetic condition that's caused by chromosomal abnormality. It's characterized by varying degrees of intellectual, developmental, and physical disorders or defects. And there's usually an extra 21st chromosome. Therefore, it's called trisomy 21. So Down syndrome is very common. I'm sure you guys have heard of it. And it does lead to a lot of complications with the newborn as they grow. Erythroblastosis fetalis is the condition of the newborn characterized by hemolysis of the erythrocytes. So hemolysis is the breakdown of blood. Lysis is breaking something down, hemo is blood. So the condition of the newborn characterized by hemolysis of the erythrocytes, it's breaking down the red blood cells. It's caused by the incompatibility of the infant's and the mother's blood, occurring when the mother's blood is Rh negative and the infant's blood is Rh positive. Esophageal atresia is a congenital absence of part of the esophagus. Food cannot pass from the baby's mouth to the stomach. Fetal alcohol syndrome, or FAS, is a condition caused by excessive alcohol consumption by the mother during pregnancy. There can be various birth defects present, including central nervous system dysfunction, malformation of the skull, and the face. If you turn to page 328, you'll see a unilateral cleft palate image of a newborn, as well as a newborn with Down syndrome. All right, gastroschisis. That's a fun word to say. Gastroschisis is the congenital fissure or opening. Remember, fissure is kind of like an open. It's kind of like a crack in the ground of the abdominal wall that is not at the umbilicus. An enterocele, or protrusion of the intestine, is usually present. So if you go to figure 9.9 on in your book, which is on page 328, you can see a gastroschisis where the patient, the newborn, has a lot of their abdominal contents outside of their body. Respiratory distress syndrome, or RDS, is it's a newborn respiratory complication, especially in premature infants. It's caused by normal immaturity of the respiratory system. Because they're newborn, their respiratory system hasn't completely formed, and so they tend to develop RDS more frequently. Spina bifida is a congenital defect. Congenital means within the womb. So anything that is congenital happens before birth. A congenital defect is, it's a congenital defect that is in the vertebral column, and it's caused by the failure of the vertebral arch to close. So congenital is something that happens in the womb as the baby is forming. And in this case, with spina bifida, it's caused by the failure of the vertebral arch to close on the vertebrae. So if you don't remember your anatomy, you need to go look at your skeletal system, look at your vertebrae, and notice where your vertebral arches on each of your vertebrae. In spina bifida, those vertebral arches do not fully close, which leads to the meninges and the spinal cord protruding out of the back. And I'll show you a picture of that in just a second. So here is a picture of a patient who has the congenital split of the lip of the roof of the mouth. One or both deformities may be present, and this is called cleft palate. All right, so let's talk about spina bifida. Again, it's the incomplete formation of the bony canal containing the spinal cord. That's what happens when that arch does not close. The canal is not fully formed. So usually this is because of folic acid deficit. So the mother has not taken enough folic acid as she was pregnant, or it's exposure to ionizing radiation, which, as we know, could be x-rays or radiation therapy for chemo or anything like that. So ionizing radiation is a big contributor to this. The degrees of neural tissue herniation. Neural tissue herniation is going to be the meninges and the spinal cord. The meninge is the layers that wrap the spinal cord or any other nervous system organ. And so it's the protrusion of it. And there's three different degrees: spina bifida occulta, meningocele, and myelomeningocele. So myelomeningocele is where the protrusion of the spinal cord and the meninges happens on the outside, and typically they have to have surgery within 24 hours of the baby being born in order to save their life, or in most cases in order to have them have a normal functioning walking and running system. Okay, we talked about esophageal atresia. This is esophageal atresia. It is where you have the congenital absence. Remember, congenital is due to the malformation during the gestation period. Congenital absence of part of the esophagus. So the food cannot pass from the baby's mouth to the stomach. This is in your book. It's on page 328. But as you can see, this is the esophagus right here, and then it stops, and then it starts back up. So it's almost like two closed ends, and there's no way for the food to go down. Well, that is a problem. Typically what they have to do is initially they have to feed the baby through a tube, a PEG tube that they insert into the stomach from the outside, kind of like where this line is how they would insert that tube. And then they would go in and they would have surgery on the esophagus to close it, to open it, so to speak, and put it together. All right, so let's look at some obstetrics surgical terms. We only have two in obstetrics. Remember, obstetrics is the study of the mother before, during, and after pregnancy and childbirth. So in childbirth and during pregnancy, you can have an amniotomy or an episiotomy. An amniotomy is when we create an incision into the amnion or the sac, and we rupture the fetal membrane to induce labor. And typically they use a special hook to do that. It is a little painful for the mother. It should not hurt the baby, but it's typically when the mother has been in labor for many, many hours and nothing has happened. Her water hasn't broken, so to speak. And by water breaking, what happens is naturally the amniotic sac ruptures and the water comes out, the amniotic fluid comes out. In some cases that does not happen, and so they have to actually perform an amniotomy, which is an incision to release that fluid. That starts the process of labor. Episiotomy is a very graphic situation. So if the baby is too large and they need to get the baby out, typically they have to perform an episiotomy so that they can get the baby out without causing severe tears in the mother's body. It's an incision into the vulva. Remember, the vulva is the outer layer, the outside of the vaginal canal. It's also called the perineum, and it can be called a perineotomy as well as an episiotomy. And what they do is they cut a slit either down the middle or to the side to allow that opening to get a little bit bigger so that these tears do not occur. Notice that this is a 3rd degree perineal tear, and this is a 4th degree perineal tear. 3rd degree is where the anal sphincter is torn and the perineal muscles are torn. 4th degree is where it reaches the rectum and tears it. That's severe, and you don't want that to happen to the mother. And so typically what happens is when they see threatening signs of perineal laceration, so they see it kind of starting to stretch and maybe tear a little bit and bleed, they know the baby's too big and they have to deliver quickly, or when the muscles are too rigid and they can't get those that area to open up. This is a very graphic image of that 4th degree tear where they have the baby has pretty much, and this is going to be very graphic, the baby has ripped through the mother. And so this is not something that you want to occur in childbirth and does not happen very often because doctors are very good about paying attention to this kind of thing. All right, now we're going to look at some diagnostic terms that are built from word parts for obstetrics. Remember, obstetrics is the study of the mother during, before, and after childbirth and labor. Diagnostic imaging during pregnancy, typically we stay with pelvic sonography. That's because sonograms or sonograms and ultrasound are the same thing. They do not have ionizing radiation. We use sound waves, so it cannot hurt the baby. Other things that we do, amniocentesis, and that is the surgical puncture to aspirate amniotic fluid. That's typically done so that they can test it for fetal health, maturity, to make sure there's no abnormalities, especially if there's a high risk of abnormalities like Down syndrome or any other abnormalities of the fetus. An amnioscope is the actual tool that they use to look into the amnion. And amnioscopy is the process of actually viewing the amnion. So here is another view of amniocentesis. This is during pregnancy. Notice how the needle, this is the patient right here, they're using ultrasound as a guide, and they are guiding the needle into the amnion so that they can aspirate that fluid. This is amniotic fluid. Notice how it's not clear, it's kind of yellowish. And so the ultrasound transducer sends these sound waves into the body. The sound waves reflect back and give us an image. And from there, we can tell where everything is, and they can introduce that needle into the amniotic sac without injuring the baby. All right, let's look at some complementary terms. There are quite a bit of complementary terms for obstetrics and neonatology. This is on page 332. I'm going to run through them. Again, if I skip over any or if you don't catch up with me, make sure you check your book. Amniochorial is pertaining to the amnion and the chorion. Amniorrhea is the discharge or escape of amniotic fluid, and that typically happens when childbirth begins. Amniorrhexis is the rupture of the amnion. Remember, rhexis is that new RRH suffix that we use. Antepartum is before childbirth, and this refers to the mother. Antepartum and postpartum both refer to the mother, not the newborn. Embryogenic is producing an embryo. Genic, to produce. Embryoid is resembling an embryo. So it is not an embryo, but it resembles an embryo. Fetal is pertaining to the fetus. Gravida is pregnant woman. A woman is who is or has been pregnant, regardless of the pregnancy outcome. So when a female goes to her annual exam with her gynecologist, they will ask her how many times has she been pregnant, and there will be nulli gravida. Nulli is none, so that is never been pregnant. And then there is multiple other indications based on how many pregnancies you have had. Gravidopuerperal is pertaining to pregnancy and childbirth, and this is from delivery until reproductive organs return to normal. So that is the entire period of pregnancy into childbirth until everything goes back to the way it should be. Intrapartum is within or during labor and childbirth. Lactic is pertaining to milk. Lactogenic is producing milk by stimulation. Lactorrhea is the discharge, spontaneous discharge of milk, which happens a lot with mothers who are newly breastfeeding. The milk will kind of discharge on its own sometimes. Multigravida, remember I talked about this. Nulli gravida means no pregnancy ever. Multigravida means that you've had many pregnancies, has been pregnant 2 or more times. Multipara means many births. So you have multi-pregnancy, multigravida, and then multipara, which is multiple births, because a woman can be pregnant multiple times without actually delivering a baby. This could happen because of an abortion or because of a miscarriage. Remember, in a surgically induced abortion or a miscarriage. Natal is pertaining to the birth itself. Let's see. What do they have on this screen? They're kind of jumping around, aren't they? That's okay. We'll read through them. APCAR score, breech or presentation, breech presentation or cephalic presentation. This is where the baby is not delivered head first. And cephalic presentation is when the baby is delivered head first. Cesarean section, C-section or CS, this is where they have to go in and surgically remove the baby. I think this is in your book starting on page 339. So they skipped a few of those terminologies. Make sure you go back and review the ones that we didn't cover on the PowerPoints. So starting with neonate on page 332, go through all of the different terms: neonatologist, neonatology, nulli gravida, remember that means no pregnancies. Nullipara is no births. Para is birth. Postnatal is pertaining to after the birth, and this is to the newborn. Remember, postpartum is mother, postnatal is newborn. Prenatal is pertaining to before the birth of the newborn, and then prepartum is pertaining to before the birth of the mother, for the mother. Primigravida is the first pregnancy, a woman in her very first pregnancy. Primipara or premip is the first birth. Pseudocyesis. Remember, cyesis is the condition of pregnancy. This is a false pregnancy, a woman who thinks she's pregnant due to psychological conditions or other types of pathologies like a tumor or a fibroid in the uterus that makes her think that she's pregnant, but she's not actually pregnant. Puerpera is childbirth, a woman who has just given birth. Puerperal is pertaining to immediately after childbirth. Teratogen is any agent that produces malformations in the developing embryo. So this could be chemicals such as drugs, alcohol, viruses, x-rays, environmental factors. Those are all teratogens that could cause malformations. Teratogenic is the producing the malformations, that it pertaining to producing the malformations in the developing embryo in the womb. And then teratology is the study of malformations by teratogens in the developing embryo. All right, let's turn back to page 339. This is AGPAR score is where we start, and that is the system for rapid neonatal assessment at 1 minute and 5 minutes after birth. And they study the baby and make sure that everything is the way it should be at 1 minute and at 5 minutes. Breech presentation is birth position in which the buttocks, the feet, or the knees emerge first. So if you look at your book, page 339 on figure 915, notice the breech presentation, the baby is going out feet first. Cephalic presentation is where any part of the head emerges first, and this is the most common presentation, the most ideal presentation. Cesarean section is the birth of the fetus through an incision in the mother's abdomen and the uterus, and we can also just call it, we can spell it Caesarean. And there is also different ways to spell it. Colostrum is a thin milky fluid secreted by the breast during pregnancy and during the first days after birth before lactation begins, and they say colostrum is actually very healthy for the baby and necessary for the baby. Congenital anomaly, remember congenital is something that happens within um, the development of the baby. It's before birth is when they usually find it through sonography or the amniocentesis process, but it's an abnormality that is present at birth. It's already happened. In vitro fertilization is also called IVF. You might have heard of this. It's a method of fertilizing human ova outside the body and placing the zygote into the uterus, and it's used when infertility is present. So they take the ovum from the mother, they extract some eggs from the mom, and they get some samples of sperm from the dad, and then they cause fertilization to occur outside of the body, and they create a zygote outside of the body, and then they implant the zygote into the uterus. And that way there is a better chance of actually continuing with the pregnancy. Lactation is the secretion of milk. Lochia is vaginal discharge after childbirth, and this happens for every woman that has childbirth. Meconium is the first stool of the newborn, and it's usually greenish black, and it has to occur for them to know that the baby's systems are working properly. A midwife is an individual who practices midwifery, and midwifery is the practice of assisting in childbirth. A lot of women use midwives as well as their obstetrician. An obstetrician is the physician who specializes in obstetrics, and we know what obstetrics is. It's the specialty dealing with pregnancy, childbirth, and puerperium. Puerperium is the period from delivery until the reproductive organs return to normal. So puerperium is about 6 weeks from childbirth, and it's for the mother and the baby. Parturition is the act of giving birth. A premature infant is an infant that's born before completing 37 weeks of gestation. This is also called a preterm infant. Sometimes they call them preemies. Quickening is the first feeling of movement of the fetus in utero or in the uterus by the pregnant woman. And it usually occurs between 16 and 20 weeks of gestation. So it's usually whenever they start to feel those butterflies and the kicks. And then stillborn is a fetus that was born dead. And this is when the fetus dies after 20 weeks. All right, so this is the type of pregnancy that everybody wants to have, which is an ideal pregnancy where you have the presentation cephalic, so the baby is coming out head first. And then this is breech presentation, and this is where the baby comes out either feet, knees, or butt first. Now, notice the spelling. Breech, B-R-E-E-C-H, is related to that type of birth. Breach, B-R-E-A-C-H, it refers to observing a law or failing to observe a law, conduct, or agreement. So breach of contract, for instance. Be very careful of how you spell breach when it comes to the presentation of the newborn. All right, so when we talk about partum, antepartum, and postpartum, are we talking about the birth of the mother, to the birth, or the mother herself? And the answer is the mother. Ante and postnatal is related to the newborn and the birth. All right, we're going to look at some abbreviations. These are in your book starting on page 342. Please make sure you are doing all the exercises in your chapter. They will truly help you understand this material better, be able to break down those terms better, be able to identify what the terms mean. It will only help you. All right, let's look at some of these abbreviations. Multi-P is going to be multipara. This is multiple births. IVF is in vitro fertilization. Preemie-P is premipara. This is your first birth. AB is abortion, and LMP is your last menstrual period. So this could be your very last one before menopause or just the most recent, your last menstrual period. All right, RDS we know is that respiratory distress syndrome that occurs in premature babies because their respiratory system has not developed properly. OB is obstetrics. VBAC is the vaginal birth after cesarean section. So females can have a cesarean section birth And if their doctor performed it properly and they were able to recover their uterus properly, then they can then have a vaginal birth afterwards. The doctor still has to be very much involved in this process, but it can occur, even though there's always been the misconception that once you have a cesarean section, you cannot have a vaginal birth. That is not true. FAS is fetal alcohol syndrome, and NB is newborn. All right, so this is the last part of this lesson. We're going to read this and talk about what it means. So if you guys want some extra points on your quiz, I'll give you 5 extra points on your quiz if you will go through this and write down what each of these bold-faced letter or words are and give me the definition so that I know that you understand this. Josephine Alcott's is a 34-year-old gravida 2 para 1 woman. So gravida 2 para 1. Her LMP was April 20th of 2000 something. The EDD is January 2nd, 2000 something, and EDD is today's date. The obstetrician prescribed folic acid to prevent spina bifida. The patient's first pregnancy was complicated by preeclampsia and a breech presentation, which required a cesarean section. So she had a cesarean initially. Pelvic sonography showed a single female fetus with normal development. She went on to deliver a healthy baby by VBAC 3 days before her expected delivery date. Please tell me what this means by explaining to me what these bold-faced letters are. And if you could, after you have identified what the terminology is, tell me what, in your words, has happened in this particular case scenario. That will give you 5 extra points on your quiz. So this is the end of our presentation, and please make sure that you are studying. We have this quiz on Friday. It is not going to be on Scantron, so expect there to be some type of breaking down of terminology into word parts, definitions, spelling, and maybe some multiple choice. All right, you guys have a great day and a good week.